Hello, and welcome to Wellness Wednesday with 3W. Wellness Wednesday is sponsored by 3W Medical for Women, a nonprofit medical clinic offering free of charge or low-cost reproductive health services to women in the Seattle area, regardless of income or insurance status. 3W does not profit off of the reproductive health choices women make. The information shared in this podcast is the opinion of the speaker or speakers. Medical information is not intended as individual medical consultation, but for general education only. Always consult your own health professional for personalized advice regarding medical decisions. And if you're in the Seattle area, consider making an appointment to consult with us. I'm Helen Nguyen, CEO and co-founder of 3W Medical for Women and the host of today's podcast. Hi there, Wellness Wednesday listeners. Thanks for tuning in. We are here with my beautiful nurse practitioner, Christi. She's been a guest here many, many times, but always so fun to have her in the studio with me because I get to learn so much. And whenever, Christi, I don't know if you know, but whenever you come, I don't do a lot of prep work so that you can educate me about things.
I love educating.
I know you do. So today's topic is this ad that I've been getting a ton on Facebook and other social media platforms. You know, as a woman, you know, when you watch something or hover over a certain ad, it kind of indicates to their system that you might be interested in the product. Mm-hmm. So this product came up quite a few times. I don't know why, but Nexplanon is a form of birth control that came up quite a bit on my Facebook page. And I went and looked at their website to see what it's all about. And then I asked Christi, can you tell me what is Nexplanon and how does it work? How does this new form of birth control work? Or is it even new, actually?
Nexplanon has been around for quite some time. I couldn't tell you the exact amount of years, actually. I didn't look at that. But it is an implanted birth control. Okay. It's considered a LARC, L-A-R-C. And what that stands for is long-acting reversible contraceptive. And there's a couple of different options for LARCs.
Okay.
And the active ingredient in the Nexplanon is primarily progestin. So it doesn't have estrogen in it. They have the medicine is kind of time release slowly from a plastic flexible rod that's implanted into the arm. And it's about 4 centimeters. And I want to say it's a circular rod about 1/8 of an inch in diameter. So
it looks like a toothpick, right?
Yeah, you could say a toothpick. I'm trying to remember what I heard it compared to. A matchstick.
Okay.
But I felt like it was smaller than a matchstick.
Yeah,
a matchstick seems kind of big to me. Yeah.
Yeah.
But it's smaller. So anyways, yeah.
So it goes right inside of your inner arm kind of area?
So it's the inner arm.
Uh-huh.
Yep. It's just below you find a groove underneath the bicep, and that's where it's injected. And what I will say is that sometimes, depending on the person inserting it and depending on the habitus of the patient, sometimes they can be inadvertently placed too deep or maybe too low.
Oh.
And actually, recently I had a patient from another country. She had 2 implanted in her gluteus.
Oh.
And I was like, I did the same thing. I went, oh, wow. Well, my guess is those are 2 Nexplanons because they felt like Nexplanons, but she couldn't remember the name, a little bit of a language barrier, but I suspect they were 2 Nexplanon, and I asked why 2 and not 1.
Yeah.
And she said, so it would last longer. And I said, okay.
Is that how that works? If you implant 2, then it'll last longer, and then if you implant 3, it'll last even longer? Or
that's not how I understand it. But unfortunately, in that situation, I tried to do a little bit of preliminary research to learn on that, but I don't think
that's how that works.
We had the accurate name down or something. But I have to say that's the only time I've seen that.
Okay. Mm-hmm. Yeah, I've never heard about it before. And so how does it work, this implant in your arm? It releases what?
It's a slow release of
Okay.
progestin.
Okay.
And this progestin, anytime you have birth control, whether it's estrogen or just progestin, it's going to impact your body's normal hormonal balance to kind of trick your body into thinking it's pregnant, preventing it from getting pregnant,
Right.
or making it more difficult for you to become pregnant.
Okay. Okay. And does it hurt to put in and take out?
That's a good question. I did actually do some research and it's pretty low. The people that say that it does hurt, I want to say it's less than 5%.
Okay.
They use a local anesthetic. You deliver kind of a local anesthetic that is superficial, and you do it over a plane of tissue, kind of the length of the Nexplanon.
Okay.
And then it's a pretty large gauge, obviously, because you got to think of 1/8 of an inch.
Yeah.
So, and then it just injects it underneath the skin. It's this fancy contraption that you load it up with the device, and then it just deploys into the arm. So, you do have to be careful because, like I said, you don't want it to get implanted too deep. It'll actually still work as a birth control. The problem is getting it out when it's too deep. So I've had a couple of patients that needed to have ultrasounds to find it, or it got kind of lost in the subcutaneous fat of somebody's arm when it was placed a little bit too low. Yeah, I think they're a lot easier to put in than they are to take out because our body knows when something's foreign, and it makes this capsule around it.
Yeah.
And you have to kind of get into the capsule, and
Yeah.
you can get it out. It does require an incision to remove. So when you go back in at 3 years, when it's expired, you have to get local anesthetic again. For some people, that's not a big deal. For some people, a little injection's a big deal. They don't like it.
Yeah.
So, and that could deter somebody from choosing that one. But you have to numb it up, make a little incision, and then kind of work your way down to the capsule, and then you can pull it out.
Oh.
Yeah.
Sorry, it makes me squirm because I'm the kind of person that hates getting her blood drawn or like inserting things. Not my cup of tea. This is why I'm not in the medical field. That's why I'm on the administrative side of things.
That's right.
Yeah. So how effective is it? You said it lasts for 3 years.
Yeah, I was on the Nexplanon site, and it's 99% effective. So it's very effective.
Wow.
Yeah. So 1 in 100 women will have a pregnancy on Nexplanon.
Wow.
So I would say it's really effective. But the other thing to keep in mind when I do contraceptive consultations, when you rely on a human being to do something consistently every single time with an activity, so using birth control in advance of intercourse, they have to do it appropriately. And so if you require somebody to take a pill or to use a diaphragm or to use a condom, you have to do it before the act. So that's where you come in with different statistics of some being more effective than others. So surgical sterilization is probably going to be, well, it is more effective than an implant. Although there's been lots of people that have had a vasectomy or their tubes tied or whatever you want to refer to it as, and they've had a pregnancy. So, which can be kind of a fun surprise for some people, but a little bit of a shocker. And then with IUDs and Nexplanon, again, you're placing those implants in the patient so they don't have to remember to take a pill. It has a high efficacy. And that kind of gets into one of the questions why people would choose the Nexplanon over other forms. And it's really just convenience. They don't have to remember to take a pill. The efficacy is high. The side effects can be interesting. I think the most common side effect is menstrual irregularity. And it's 1 in every 10 people.
10? Wow.
Is what I saw on the Nexplanon site. So that's pretty high.
Yeah, that is really high.
And I have to say, with the patients, anecdotally, that's what I experienced from my patients.
So when you say period kind of irregularity, does that mean like sometimes you have one, sometimes you miss it, it doesn't come like if you're tracking it, it doesn't come when it's supposed to? It's either very heavy or very light.
Mm-hmm.
Are those the kind of irregularities?
It's spotting, shorter cycle or shorter menstruation flow, like days, or longer, heavier, more painful, always spotting. I was just talking with Dr. Rutherford, my colleague, and she was sharing a story with me about patients complaining about this very thing and talking about how when you think about the menstrual cycle and when you think about our normal hormones, estrogen helps us generate a plush endometrial lining that is ideal for implantation of a fertile egg. If you take certain hormones and even combined oral contraceptives where there's some estrogen and progestin, it is going to keep that uterine lining thinner, less than ideal for implantation. It just makes it more difficult to get pregnant. Like I talked earlier, it kind of tricks your body into thinking that
you're always pregnant.
Yeah, you're always pregnant.
Yeah.
So when you think about progestin-only contraceptives, which are common in the LARC category, which is the long-acting reversible contraceptives, like IUDs and Nexplanon, it is progestin only, so it always keeps the uterine lining thin. So you never grow out the endometrial lining because you don't have as much estrogen because you have supplemental progestin. So she was telling me about a situation where she had a patient that was constantly spotting, and she was consulting with another one of our colleagues, and he was sharing with her how this particular woman needed some estrogen added to the mix to help her resolve this issue of constantly bleeding. And it's kind of hard to wrap your mind around, but because the progestin is keeping the uterine lining thin, it's thin and you'd think she's not going to spot or menstruate, but it's kind of, for lack of better words, raw. And it just needs some estrogen to replace that lining so that it grows at least a thin layer to keep it kind of at baseline.
Right.
And then it was interesting because then in that conversation, I was sharing with her how in my training, when I learned how to insert Nexplanons, they will tell you to put your patient on combined oral contraceptives at the time of insertion, which they didn't explain it to me like Dr. Rutherford did. They explained it as it'll just help with the irregular spotting that most women complain of. Because what happens is if you don't educate your patient and if the provider's not aware of how to resolve the issue, the Nexplanon will be removed prematurely because most women, I've seen women that have tolerated almost constant spotting or irregular menstrual cycles for a year. And then they're just like, okay, I'm ready to have this removed because it's not working.
Yeah.
So the idea of when I was trained to give them the combined oral contraceptive at the time of insertion seems like you're using two birth controls, right? That was my first thought of, wow, you're really going to just kind of hit her hard with all these hormones.
Well, the whole point of putting in the Nexplanon is like so that you don't have to take this daily pill. And then now you're telling me I have to insert it and take the pill.
Yeah.
It's kind of contradicting.
It is contradicting, isn't it?
The whole point.
So they say anywhere from a month to 3 months. And what that does, now having talked about this with Sue, is it probably replenishes that layer so that she's just not always kind of oozing from the uterus.
Oh boy.
So,
okay.
Yeah.
And I'm assuming constant spotting.
Yeah, it's a spotting.
It's probably not the best. because thank God I have very regular periods. I should be very thankful about it. It's a sign of health, right? It's a sign of good fertility and ovulation. Even though I'm infertile, it's still something that I should look forward to. But it's like, it's not fun, having your period.
Right.
And the whole process of like having to carry pads and tampons and all of that stuff. It's like such a hassle sometimes. But having to spot or have irregular periods up to a year, that's pretty intense, I feel like.
Yeah, I agree. And you bring up a good point because you said something to the effect of always kind of spotting or when it's most days out of the month. When you think about iron deficiency anemia, it's more common in women of childbearing age because of their menstrual cycles. Now, not everybody has iron deficiency anemia, but that's a population that you're going to see it in. So I've never done a study to actually look at this, but it just kind of came to mind of, if you're just bleeding all the time, then you're slowly bleeding.
Yeah.
And, I guess it could be a risk for anemia.
Okay. So how is it different from the IUD?
So the IUD, the difference is really location.
Okay.
The dosage is different, but the IUD is similar in that there is a main rod. I liken it to an umbrella because when you have it placed, it's closed. It's like a rod. When you're inserting it into the uterus, you deploy it and the arms open up. So it's 2 arms.
Yeah.
And the medicine is going to be in that center rod. And the 2 arms keep the IUD in the uterus, preventing it from coming out of the cervix. So when you take an IUD out, it's like turning the umbrella wrong side out.
Yeah.
And the arms fold up and it comes out. Wow. And so the medicine is delivered slowly, again, slow release. And over the course of, you can have some that are 3 years, 5 years, 7 years. And I think, sometimes people will leave an IUD in beyond the expiration date, but they have an FDA approval time.
Yeah.
Yeah.
How about the Nexplanon? Once it's expired, is there like a hard deadline? Like if you have like sex a week after expired, oops, you're going to get pregnant, Is that how that works? Or?
That's a good question. I would say if you're not wanting to get pregnant, probably shouldn't take the risk. But I was just reading that they have done some studies and have seen that it can be effective up to 5 years. But it's strongly, strongly recommended in every area, on Nexplanon site, on multiple other sites. It should be removed at 3 years.
3 years. Okay. And why? I guess does the tube itself like starts rotting or something?
No, I think it's pretty benign, and then the body encapsulates it. Okay. So it's keeping that away from you. It's safe.
Okay.
But this slow release of the progestin is just going to slowly decrease. And what's interesting is when you talk to a patient, like I can think of many primarily with IUDs that will say, oh, hey, I have noticed the first 2 years of my IUD, I didn't have any periods. And now I'm starting to spot. And so that just kind of, you can draw a conclusion that they're likely, the hormones are starting to go down in the IUD. It's still effective or working effectively for them. Okay. But yeah, they just start to deplete. So how it works a couple more years, I don't know.
Okay. And how does the slow release process work? How does it know to release it?
That's a good question. It's just the way that the body of that rod is built to just release it slowly. Because I think about the same thing with the IUD. I don't really know that much about the mechanism of how it's released. Yeah. Because I have often thought to myself, how does it know not to release too much?
Like too much. Yeah, that's what I was thinking.
But if you look at some of the inserts, if I am not mistaken, now it's been a while since I've looked at these, but with the IUDs, I think the daily release amount is higher at the beginning and then it's lower. And I think just over time it must change. So I don't know. You would hope it would just be pretty constant, right?
Yeah. It's just interesting.
The science of it.
Yeah. Because it's like, how does it know how much to release? Are there different dosages that you can get in the Nexplanon?
Yeah. Well, no, in the Nexplanon, not that I'm aware of. No.
Okay.
But with the IUD, yes, because it has to last a certain period of time.
Yeah.
But that's a really good question.
I'm just thinking like a tiny little computer just going, doop,
Yeah.
like release
today. Yeah,
Yeah.
I know.
It's fascinating. So what should one consider or be cautious of when considering Nexplanon? Like what type of information would you encourage patients to understand or fully be aware of before they consider Nexplanon?
So some of the things that I go over when I have a contraceptive counseling session with people is there's something as providers, we should be looking at medical eligibility criteria. And medical eligibility criteria is a really busy chart. I use it as a teaching tool with my patients. This is why a patient's history is so important. And this is why you follow up with patients once they start a contraceptive to see how their body's responding to it. Because you want to make sure they're not in a category where they're not a good candidate for this. The progestin only, I will say, is probably safer when you're looking at people's health history. When you use estrogen, it's prothrombotic, so it can put people into a different risk category for like blood clots, particularly if they have certain things in their history like migraines with aura, hypertension, tobacco users, over the age of 35. So there's lots of little things you have to pay attention to. And I mean, it's just one of those things in a traditional clinic where you're really busy. Oftentimes, patients will slip through the cracks. They won't come back for their 30-day check. And you really, when you put somebody on a combined oral contraceptive, you need to be checking their blood pressure in a month and making sure it's not causing them to have an elevated blood pressure. I've had tons of people that have been 35, 40, they're still taking their high dose estrogen combined oral contraceptive, and they're obese with hypertension. And that's not a desirable situation. So it's something that women, and oftentimes to no fault of their own, because it requires education, like teaching them there's a limit of time. At some point, this will last, or this might be a good choice for you up to this age, but it's your responsibility to check your blood pressure, to maintain a healthy body weight. If you smoke tobacco, it significantly changes the whole game. And once you're over 35, that changes the game too. So lots of little things to consider. So when you think about oral contraceptives with estrogen, and the estrogen is the reason of concern here in this conversation, progestin only is a good alternative for women who can't take estrogen containing products. So somebody with migraines, with aura, or hypertension would be better suited with a progestin IUD, a progestin only pill, or the Nexplanon implant.
Okay. Okay. Who would be a good candidate for Nexplanon?
So a good candidate for Nexplanon would be a woman who did not want to have a pregnancy, maybe young, healthy, and couldn't remember to take her oral contraceptives regularly. That would be somebody that you might consider.
How are you supposed to remember it in 3 years?
I know. That's a good.
I mean, that's for
it'd
me.
It'd be somebody that goes to the doctor regularly, I guess.
So you would recommend someone to go to their primary care and go to one person on a regular basis, and so they kind of
have good continuity.
Yeah, kind of wrap around care in a sense. Am I using that term right?
Yeah.
Wraparound care.
Yeah.
In a sense of like they're following you from the moment you got it implanted to the 3-year mark.
Right. You would think that, providers are getting to know their patients, and when they come in for their annual wellness visit, that they would say something about, addressing every aspect of that person's care and saying, so, hey, you're still using your Nexplanon, because there could be, maybe they were out of town and something happened and they had it removed. So following up with that patient and just saying, you still have it. You should palpate it on exam every time you see your patient. Make sure that you're still seeing that it's there if they're coming in for an annual exam or something focused on contraceptives. But to my knowledge, I don't recall ever knowing of a facility that would send like a reminder recall that it's time to have it out. So it's really up to the woman to come back. So that doesn't always happen when you have somebody in their young 20s.
Exactly. Exactly.
So that's a really good point.
Yeah, that it's always kind of boggles my mind about like, okay, you have this expiration date and it's far out, which is nice because then you don't have to think about it. But then you will forget in your busy life with so much going on to say, hey, how long has that, thing been in my arm? And is it time to take it out yet? Does it ever cause any like skin irritation or rash, or can someone be allergic to it?
Yeah, they can actually. It was interesting because on some of the research that I did, they actually have it grouped into mild, serious, allergic. And then the Nexplanon site, I really liked that site because it kind of went into this chart where it was talking about menstrual irregularities and the statistic on the menstrual irregularities were women that were removing it prior to the 3-year. It was almost always related to the menstrual irregularity. But some of the symptoms can be, one of the ones that can bother women a lot is weight gain, 5 to 15 pounds, and it begins relatively quickly after the initial insertion. In fact, I had a woman today where she was having hers removed, and she did share that she had gained a significant amount of weight initially right after insertion. So
it's interesting.
It is. It can cause acne because you're fluctuating your hormones. These are straight from one of the sites: back pain, belly pain, breast pain, dizziness, headache, vaginitis, sore throat. You can have an implant site reaction. There can be bruising just from the implantation. And likely even, it depends again on the provider inserting it, depending on their skill with putting lidocaine in. You can have bruising anytime a needle touches you, right?
Right.
But some people might respond to the cleaning agent that they use before they insert it. And again, change in menstrual pattern, irregular bleeding, spotting, weight gain, blood clots, diabetes, high cholesterol, depression.
Diabetes.
I know it can. One of the serious side effects is change in metabolism causing high cholesterol, diabetes, blood clots, depression, ectopic pregnancy, high blood pressure, ovarian cysts, and allergic reactions would be more of a skin rash, itching, flushing, or discoloration of the arm. I would expect an allergic reaction would be more acute and present soon after it. And then you're going to have similar things. When you have it removed, you could potentially have the bruising, the skin irritation.
That's a long list of intense side effects.
It is. It is, because if you think about it, anytime you alter hormones, some of those mild ones, you can have a lot of those just with any oral contraceptive or other contraception options that you might consider, because we come with our own set of hormones and then we're throwing more into the mix, or we're kind of altering them, and there's side effects that come with it. And I think it just depends on the woman, but I will hear, every now and then I'll have a patient that just loves their birth control, no known side effects. But more often than not, I'll have somebody with at least one or two small complaints with it, whether it's the breast tenderness, a headache. And that goes with when they initially start it, or if they forget it, or when they're stopping it. Because again, when you stop it, you're withdrawing the body from something it's been accustomed to, right?
Yeah.
So it changes the game again.
So fascinating. Well, if folks have more questions about Nexplanon, compared to other types of birth control, or why they think they are a great candidate, maybe first come and have a consultation with Christi and see if you're a good candidate for this form of birth control, or if there might be something else, or the issue that you're trying to address might be something that doesn't need birth control. It's so important that you're well informed. And that's why we love doing these types of podcasts, because then you can listen to it and you could, come up with your own questions that we might not be covering, and come in and get some free free consultation with our medical providers. Because you should know what you're inserting into your bodies and what pros and cons there are and weigh them. Of course, we're not going to tell you what to do, but I think you should have full consent and fully informed medical. I feel like it's like a legit medical procedure because you have to like
it's a little procedure.
Yeah.
It is. And one of the things, just going off as we wrap up, Helen, I just want to make sure that I tell our listeners, when you do choose an implantable birth control, while it is effective for providing birth control because you don't have to remember it every day and it works well for some people, it has nothing to do with preventing STIs. So I always want to make sure people know that there's no protection offered with this form of birth control. If you're having intercourse, you have to use a barrier to protect yourself. And that's probably one of those things I would consider important to educate, especially in the younger female population, because oftentimes when somebody does have an implanted device, it's not as important that they have a barrier, but when at the end of the day, it's important if they want to have something to protect them.
Thank you so much for that reminder. I did not connect those dots.
Yeah.
Because I would think, oh gosh, it's covering everything.
Yeah.
But it's not.
Yes.
So please take advantage of Christi and her ability to educate so thoughtfully and, making sure that someone like me who don't know anything about this is able to understand it so well. And so please take advantage of our services here and come in and educate yourself about this. Is there anything else you want to leave our listeners, Christi, about Nexplanon?
Not really. Just educate yourself, look at multiple sites, consider your past medical history, and fully weigh the risks and the benefits.
Yeah. Well, thank you so much for joining us. Until next time, until our next topic, thank you so much. Bye-bye.
You're welcome. Bye.
For more information about 3W, please visit our website at 3wmedical.org. That's the number 3, the letter W, medical.org. From there, you can learn more information about the services we provide, book an appointment, or make a donation if you'd like to support our mission. You can also call our office at 206-588-0311. That's 206-588-0311. If you like this episode, please share it with others and consider subscribing on your favorite podcast platform so you never miss an episode. Thank you so much for listening, and until next time, stay healthy and be well.